Yeah, is it visible?
Yes, sir. Your screen is visible, sir. Can you make a slideshow? Yeah. Yes, sir.
This is for everyone, or this for only for Dr. Gopichan?
No, sir. This is for everyone. They have to answer in the chat box.
Okay, okay.
We can see the answer in the chat box, sir.
Okay, so can anyone identify this abnormality? What is the abnormality in this fundus photograph?
Please put your answers in the chat box. Mm.
Okay, Dr. Sneha has answered as aggressive posterior ROP. Yeah, that is the right answer. You can see the dilatation and tortuosity of the retinal vessels. Yeah. And the second question is enumerate the names of two predictive models for abnormality. Means, are there any predictive models through which you can predict the ROP in such babies using a weight, insulin growth factor, or gestation, and so many things as a surrogate of developing ROP? Can anyone name? Hello, I'll call you Chandrasekhar in 10 minutes. Okay, so in that slide you saw there was a dilatation and tortuosity of the vessels, and these are the predictive models. Okay, win drop score, chop ROP, and DG ROP. So can anyone name this tracing? What is the tracing and what is the abnormality? Okay, Dr. Rajesh and Dr. Nisha, Dr. Anil have mentioned as NST or CTG. Okay, so what is the abnormality? CTG. Dr. Ravikant has mentioned rightly. So what is the abnormality? Yes, very good. Dr. Yamini and others, Dr. Rajesh have mentioned as late deceleration. Right? You can see the uterine contractions below here and the fetal heart rate in the above graph. At the end of uterine contractions, there is gradual fall in the heart rate. So it is a late deceleration. Okay, so term female newborn was noted to have a significant respiratory distress soon after birth. Study the X-ray and answer the questions. What is the diagnosis? Okay, it is CDH. Can anyone tell, is there any abnormality, other abnormality in the X-ray apart from CDH? Excellent. Dr. Yamini and Dr. Rajesh, everyone has mentioned as TEF. Yeah, you can see here there is a coiled tube here, orogastric tube. This baby had both CDH and TEF. So any antenatal ultrasound criteria you can is there to classify this condition as a severe CDH? Already Dr. Rajesh has mentioned LHR. Okay. Is there anything else? I mean, in LHR, any modification in LHR? Okay. So yes, something called observed to expected lung head ratio, which is corrected for the gestation. If it is less than 25%, then the survival is less than 30%. LHR you usually take as less than 1 to 1.4 and more than 1.4. But observed to expected lung head ratio is more appropriate. Okay. Can you identify the intervention and first name the condition and for which condition this intervention is being used? To give a clinical clue, this baby had cyclical cyanosis, means the baby had what you call, yes, corneal atresia. Dr. Ankita and Dr. Sukanya have mentioned it. So this baby had corneal atresia, and here the baby is being managed with a Macron's nipple, or even you can use a pacifier and cut the end of the pacifier and you tie across the baby's neck. So basically, you have to keep the oral airway open. Yeah, bilateral corneal atresia. So this I'm going to skip statistics question. Okay. Um, yes. This is a forest plot. Can anyone mention what does the square boxes represent here? This can be asked as a common OSCE questions for you. So this is a forest spot. What does only this box? I'm not asking about this line. What does the solid boxes represent? Okay, most of you are answering as CI. And what does I square means? Can you see here? I square is 0. I square and chi square. What does I square mean? Okay. Someone has mentioned as power. So basically the square box represents the size or the weightage which is given to the individual study, and the horizontal line represents the confidence interval. We'll go back to the slide and see. Yes. So you can see here the square boxes. This box represents the weightage or the size which is weightage given to this study in this meta-analysis. You can see here the weightage is 37%, right? So the more the weightage given to the study, the bigger will be the box. And this horizontal line represents the confidence interval. You can see here the confidence interval is 0.32 to 2.15. So 0.32 will be somewhere here till 2.15. So this is a wide confidence interval, right? And I square represents the heterogeneity. Okay, just two X-rays. Can anyone tell? First, we'll concentrate on the left X-ray. So, can you tell what is there in this X-ray? What abnormality you can see? First, this X-ray will concentrate. Okay, someone has labeled as mentioned as pneumothorax. Anything else? Excellent. Dr. Rajesh has mentioned as fracture, multiple bone fractures and fracture humerus. Dr. Sukanya has mentioned as fracture humerus. Yes, this baby, if you can see here, there are multiple fractures, not only fracture humerus, even the femur also there was probably a fracture and multiple fractures in different stages of healing. Yes, Dr. Ria has mentioned rightly, it is a case of osteogenesis imperfecta. And even if you see the ribs here, the rib fractures are also there and they're in multiple stages of healing. Here also in this humerus, there is a fracture. Okay, let us concentrate on this X-ray. This baby presented on day 1 of life with abdominal distension and bilious vomiting at 18 hours of life. Okay, Hirschsprung's disease. Anything else? It was actually the anal opening was not there. It was a case of imperforate anus. DA means what? No, it's not duodenal atresia. So it was a case of imperforate anus. Anything else in this X-ray? This was actually a case of imperforate anus. You can see here the rectal gas shadow is not visible in the X-ray. Anything else in this X-ray? Any abnormality? Yes, this is a case of imperforate anus. Clinically, it was imperforate anus. Any abnormality can you mention in the X-ray apart from this thing? Excellent. Dr. Hema has mentioned it as vertebral abnormality. You can see here there is a hemivertebra. So any case of ARM TEF babies, always make sure you look at the vertebra to rule out bacterial abnormalities. You can see here there is a vertebral abnormality. There is a hemivertebra here. So a 9-day-old term baby presented with lethargy, poor feeding, and a short episode of focal clonic seizure. Lumbar puncture was done and CSF analysis was reported as followed. Cells were 120, protein was 130. There was low glucose at 22. So what is your interpretation of CSF analysis? It's a very straightforward and a simple question. Yeah, it's a meningitis. Okay. So this preterm baby was being ventilated for severe RDS. The baby was deteriorated despite chest drain being inserted. So can you tell what is the finding in this baby? I mean, what is the abnormality in this X-ray? Yes, ICD position is not proper. The baby still has persistent pneumothorax. ICD is deeply placed. Okay, this is alprostadil injection. What is the indication for use in the NICU? And two common adverse effects. To maintain the patency of PDA, yes, pulmonary stenosis, basically duct-dependent lesion. Any duct-dependent, either systemic circulation or a duct-dependent pulmonary circulation, we have to use alprostadil to keep the PDA open until you refer the baby to a higher center. And side effects, bradycardia, pulmonary hemorrhage, these are all not common side effects. Anything else? Apnea, yes, apnea is a common side effect. Then apnea and fever, these are the two common side effects, and hypotension. Okay. So this is the last question probably. A term neonate noted to have a persistent respiratory distress. So the ultrasound cranium was done in this baby. This baby had persistent respiratory distress, and outside hospital, the baby was managed as a case of PPHN. The baby had signs of heart failure also. Can anyone tell what it is? Excellent. This is Dr. Hema has mentioned. It's vein of Galen malformation. Most common treatment option is you can do coil intervention. Okay. I'm done, Dr. Nalina.
Thank you, sir. Thank you so much for joining this session, and your questions were very useful to us and very interesting questions, sir.
Thank you.
And ma'am, I think Janki ma'am is also there. I think, ma'am, thanks a lot. And Sarita will contact with you for the scoring of these three students' examinations, sir. I request you to score for them also.
Okay, sure.
Okay, thanks, Dr. Nalina. Thank you.
Thank you. Thanks a lot. Thanks for attending this session. We have 35 attendees at the end of this session. That is very good.
Thank you, ma'am. Thank you, sir.
Thank you, Dr. Nalina. Thank you.
Thank you.